Hello, this is Katie Christensen, and I'm doing a PowerPoint on Kaiser Permanente. And I wanted to start with some of the facts. There are different kinds of healthcare organizations, different multi-hospital organizations or integrated health systems. And Kaiser Permanente is a consortium of for-profit and not-for-profit entities. They were officially started in 1945, but they actually started much earlier during the Depression. And it was started by Sidney R. Garfield, and then later Henry J. Kaiser joined in. They worked together. So they have a mission statement, and they like to talk about their outlook for the future. Kaiser Permanente has a community, or is a community, of 17,000 physicians, and that number goes up and down. It's gotten down pretty low, 13,000, then it goes up, but currently it's at 17,000. And they're committed to providing excellent care today, which leads to healthier tomorrows. And they cover a wide range of things. They're not just a primary care provider. A brief history: the height of the Depression, not the most recent one, but the one back in the 30s, actually. Dr. Sidney Garfield was a surgeon, and he built a hospital for construction workers working on the aqueduct in the Mojave Desert. But the insurance companies weren't paying the bills on time, and he was spending more than he was bringing in. So prepayments are born. He decided he was going to have a prepayment system where healthcare coverage for the workers could be paid on a monthly basis of $1.50, and an additional 10 cents a day. The workers could get coverage for non-job related medical problems. The pattern that he started, he moved along to the Grand Coulee Dam construction site, and he recruited a team of doctors to work in a prepaid group practice. Henry Kaiser started working with him as they moved this organization to the Richmond shipyards. In post-World War II, the number of members reduced to 12, so they had to open it up to the general public, and that took place in October 1st, 1945. In 52, they changed the name to Kaiser Permanente. So today, Kaiser Permanente claims that they are the largest hirer, employer of the top physicians in the country. This Kaiser Permanente is made up of 3 independent groups: the Kaiser Foundation Health Plan and its regional operating subsidiaries, Kaiser Foundation Hospitals, and regional Permanente medical groups. As of 2014, they are in 8 states, including, or as well as DC. And they're doing pretty well. There are 6 regions: California, North and South, Colorado, the Denver area, and the mountains and South, Georgia, Hawaii, Maryland, Virginia, DC, Oregon, Seattle. Kaiser Permanente had 9.6 million health plan members and employees, physicians, nurses, medical offices. They're doing quite well, actually. The nonprofit Kaiser Foundation plan reported a combined $3.1 billion in net income and over $56 billion in operating revenues. Each Permanente medical group operates as a separate for-profit professional corporation. And reports its financial results publicly. I mean, they don't report publicly. Each is primarily funded by reimbursements for costs. There's some criticism out there. They've had some haters, you could say. As of 2015, $21.7 billion in cash revenues, which was quite a lot. It was 1,600 times more than required by the state of California, and quite a bit in Colorado as well. 666 million in revenues, which is 1,300 times the minimum required there. In 2008, Colorado regulator required Kaiser to spend down its reserves. I thought that was fascinating, that a state could force a private entity, a for-profit entity, to spend down its monies. So they did. They spent. They agreed to spend 155 million of its reserves, giving credits to its clients. So that was awfully generous, and building clinics in underserved parts of the state. They were convicted of patient dumping. So they would take cases that weren't healing as fast or doing as well, and they would drop them off at a public institution, like a government hospital. And one person was found, filmed, an older gentleman was filmed walking towards a state-run healthcare facility in just his smock, his hospital clothes that he was given at Kaiser Permanente. I assume that they had their name on his jammies. I don't know how smart that was, but anyway, they didn't do so well. Their performance has been attributed. They've also gone with unions, and had to work through a lot of negotiations there, but they've actually turned out pretty well. They've been fine. In the California Healthcare Quality Report, they got 4 out of 4 stars at meeting national standards, and 3 out of 4 stars for member rating their HMO. It's called members rate their HMO. Kaiser Permanente's performance has been attributed to 3 practices. First, they place a strong emphasis on preventative care, reducing costs later on. Second, its doctors are salaried rather than paid per service, and so they don't perform unnecessary procedures. And thirdly, they attempt to minimize the time patients spend in hospitals by carefully planning their stay and by shifting care to outpatient clinics. Not exactly dumping, since it's probably their own clinics. A comparison to the UK's national health system found that patients spend 2 to 5 times as much time in the National Health Service hospitals as compared to the Kaiser Permanente hospitals. And they are looking for people to cover and to hire all the time. They have a website devoted just to that, and they have many websites, and they have Twitter accounts and Facebook, and they're just very tech savvy and with the times, I would say. Good communication there. They need everyone from radiology to nursing to sales and marketing, IT and pharmacy and financial. I think anything that any healthcare administration is definitely needed. I think they keep wanting to grow and to expand. And there's my references. And what I learned, or what was interesting to me, was how complex this hospital is. Well, it's not just a hospital, but how complex this organization is. That it's integrated, so it has providers and patients and physicians and health plans. So I was kind of curious about how health plans tied in, but now I know. So Thanks. I think that was quite an interesting project.